So let's talk about the situation right now that we're experiencing in America with just a massive surge of the COVID-19 virus that is really dominating the news and dominating the economies and the daily lives of so many of us. So as of now, America has over 4 million confirmed cases of COVID-19, over 145,000 deaths. There are many top scientists within America and globally that are pleading with politicians to do really a hard stop, to shut down the economy again, which I know we can't handle financially, but in order to really get things under control, there's a suggestion from leading scientists that is what would be necessary. And also there's talk of the COVID-19 becoming really the 10th leading cause of fatality in America. So this 5% fatality rate, when amplified over the millions, is quickly catching up to other causes of fatality in America at the point where it may make it to the top 10 list, which is not a list we wanted, and that's for sure. So what are we supposed to do? I mean, everyone's at a point where unemployment benefits are running out. The extra kicker that was added, $600, for example, is expiring soon. Meanwhile, we're waiting for politicians to negotiate and make up their mind on a new stimulus plan that may extend that. Who knows what will happen there? And also there's talk about economies having to kind of reverse course and partially or fully shut down again, especially in certain states like Florida and Texas and other states as well. It's just really very, very dire situation right now in America compared to the rest of the world. Things are definitely very challenging in Brazil with 2.3 million cases. Brazil is pretty far behind America, but certainly too close for comfort. India is up to 1.2 million. Russia, 800,000. South Africa, over 400,000. Mexico, 378,000. So, globally, when you look at the global count, 15,803,000 plus confirmed cases of coronavirus and 638,000 fatalities. So I remember when this started and it was being called an epidemic, and the World Health Organization was so reluctant to call it a pandemic and so reluctant to shut down travel. And I have no idea why in the world it was that way. And there's various accusations back and forth between the U.S. and the World Health Organization, the WHO, and China about all of this. But long story short, bottom line, the WHO really got it wrong. They should have really classified as a pandemic much quicker. I know from my perspective, it sure was pretty obvious it was a pandemic. And I think from everyone else's perspective, a lot of this, it doesn't take a scientist, it doesn't take a team of scientists to figure out. I think we all figured out early on, this is spreading quick and it's out of control. It's not a good time to travel. Let's stop travel. And I think regular citizens could have come up with a lot of this, but in the end, that's what was required. Social distancing, very, very important. Keeping away from other people, temporarily shutting down economies, staying home. And a lot of those solutions are what proved to be very effective in much of the world and not so much in America. It's very interesting, and I'm not a conspiracy theorist, although sometimes I do talk about things that are controversial. But in this case, when you consider how at odds America and China are with each other, really on so many levels. We have a consulate that was just shut down in America, Chinese consulate. Likewise, China followed with shutting down an American consulate in China. And there's been this bitter trade war and things have escalated. Now we've got the coronavirus, which started right around the Chinese New Year in Wuhan, China, not far from the Wuhan Institute of Virology. And it has just decimated world economies and populations and mass infections, mass deaths, disrupted so much. And is it really by coincidence that the worst hit country in the world in terms of number of cases and fatalities is America, and it started in China? Is that coincidence? Well, it very well may be. It certainly may be. But it sure is, of all the countries to be hit the hardest, one of the countries that has very advanced healthcare. Now, it may be just a long chain of bad decisions and delays and poor guidance and other factors that led to that. But is it something more? Who knows? All we know for sure is that it's really wiped out America on so many levels. America is staying proud and strong and pushing forward. despite the massive surge we're experiencing. People are going back to work, they're taking the chance, they're going out there, they're doing what they need to do to feed themselves, to feed their families, to support their communities, but the virus is spreading like crazy, more so than in China where it started, which is very, very interesting. So when you look at the statistics, it's just quite shocking that the country where it began has fared so more favorably than have faraway countries such as America, for example. So China, 83,750 cases, and China is a huge, huge country, a massive country, 83,000 cases and 4,600 fatalities, compared to America with 4 million plus cases and 145,000 fatalities, and yet it started in China. So what's up with that? In any case, really, the point of this episode is just to talk about where we find ourselves and what are we supposed to do in America. The problem is people just can't afford to shut down again. As much as it may make sense to shut things down and stay at home and go back into quarantine lockdown status, and if we were to do that for a month, it would certainly have a major impact on stopping the spread of the virus. But who can afford to do that? I know so many people, and also have so much feedback from subscribers on their situations, and it's just people are at a point where they don't know how they're going to pay their bills like tomorrow. They don't know how they're going to pay their mortgage or their rent next week. They don't know how they're going to pay their bills, and benefits are starting to run out and run low, and how can we really shut down for another month? Everyone's going to file bankruptcy. Companies can't handle it. Nobody can handle it. So we don't have a choice. At this point, it seems that we're in a situation where we have to push forward, hope for herd immunity, hope that we get a vaccine, which is going to take a long time, or at least an effective treatment, and move past this. And I sure wish there was better collaboration between countries. When you look at countries that have such a low infection rate and, more importantly, such a low fatality rate, it sure seems that there should be a higher level of collaboration between countries. Maybe it's happening, but if it's happening, it sure isn't happening as it should, because if we were simply to follow how other countries have addressed with great success the pandemic, and we were to duplicate the efforts that were taken, it seems that we'd have much more favorable results as well. So wherever you may be, I realize some of you are in America, some of you are all over the world in many places. We have subscribers from everywhere and viewers from everywhere. So wherever you are, I hope that you're safe and well. I hope that the curve is flattened. I hope that things are improving. I hope the fatality rates are dropping. Medical care is improving, and hopefully you're getting to the point where a sense of normalcy is resuming. Hopefully there are hospital beds available. There are some countries where hospitals are quite full right now. So in closing, just want to mention to everybody, this is not a good time to catch the virus. Please be as careful as possible, because right now you're at a point, in many countries at least, I shouldn't say that overall it's never a good time to get the virus, but right now in many countries, and specifically in many regions of countries, in specific states and even cities, hospitals are nearing or at capacity, and at that point, that is not the time to catch this virus when you may need ICU care and may not be able to get ICU care. So it's really important to stay safe. It's important to use alcohol on your hands, or at least hot water and soap. It's important to take vitamin D, 5,000 IUs, the recommended amount. People with vitamin D deficiency or lower levels tend to be more likely and susceptible to the virus. At least that's what reports are saying. Vitamin C is helpful as well. Eating healthy, plenty of sleep, get some exercise, keep your immune system strong. Ultimately, we're on our own. It's our own decisions that will either improve our chances of avoiding this virus or decrease our chances of avoiding it and increase our chances of catching it. So please stay safe. Take a moment to click subscribe, the bell, and all for notifications, and like if you found it helpful. Wish you the best. Stay safe. Goodbye for now.